understanding kyphoplasty and vertebroplasty for spinal fractures. If you or someone you love has suffered from a spinal fracture, especially from osteoporosis, you've probably heard terms like kyphoplasty or vertebroplasty. But what do these words actually mean and how do they work? In this video, I'll explain both procedures in plain English and help you understand if it might be right for you. Hi, I'm Dr. Deeptee Jain. I'm an orthopedic spine surgeon, and I specialize in the spine from the skull down to the sacrum, and especially in vertebral compression fractures. My goal is to help you make informed, confident decisions about your care. If you're looking for trustworthy spine health information, be sure to subscribe. So a vertebral compression fracture happens when the spinal bone collapses, often due to osteoporosis. There are other causes as well, like trauma or tumor, for example. However, they're less common. This can cause intense, sharp back pain, loss of height, and even a stooped posture, or what we call kyphosis. If left untreated, these fractures can severely impact your mobility and quality of life. Vertebroplasty or kyphoplasty, which are very similar procedures, they're minimally invasive procedures where a special cement is injected into the fractured vertebra, the fractured bone. This stabilizes the bone, reduces the pain, and helps prevent further collapse. It is often done under local anesthesia and takes about 10 to 15 minutes. Most patients report rapid pain relief within hours. As I mentioned, kyphoplasty and vertebroplasty are very similar procedures with one minor difference. In a kyphoplasty, a tiny balloon is inserted through the cannula to gently lift the vertebra and create a space for the cement to go. This can help potentially restore height and correct spinal alignment, especially if the fracture has caused a wedge in the bone, but candidly, I don't often see this to be the case. Both procedures reduce pain and stabilize fractures and are almost the same thing. I kind of say it's like tomato, tomato. I personally perform kyphoplasty to give this cement a good cavity to fill once the balloon is removed. You might be a good candidate for vertebroplasty or kyphoplasty if you have sudden severe back pain from a recent fracture. Your imaging confirms that you have what's called a compression fracture. You've tried non-operative treatments like rest and pain medication, maybe physical therapy and bracing. And you have osteoporosis or potentially a traumatic injury. These procedures are usually not recommended for fractures that are older and healed. They're more for newer fractures. Recovery is typically fast and minimal. Some surgeons perform this procedure in the hospital, and you may be admitted, but I personally perform all of these procedures in my office. This is done under local anesthesia as well as some oral medications to make you a little bit sleepy. The procedure itself takes about 10 minutes. You can usually resume light activities within a few days. Pain relief happens quickly. I tell patients frequently, you walk in with a lot of pain and you walk out with your pain substantially improved. Most patients report a major improvement in daily function within the first week. Like any procedure, there are risks associated with it. Although complications are very rare, it is a needle poke after all. These may include cement leakage outside the vertebra, infection, allergic reaction to anesthesia or cement, or potentially a risk of another spine fracture. Now keep in mind, oftentimes patients with this problem have osteoporosis, and so that means that their spine is at risk for having another fracture regardless of whether the procedure is performed or not. So to recap, vertebroplasty and kyphoplasty are safe, effective treatments for spine fractures. They stabilize the bone and reduce pain. Recovery is quick, and most patients get back to life faster than they expected. These are powerful tools, especially when fractures are caught early. If this video helped you understand these procedures, give it a thumbs up and drop a comment with your questions. I read everyone, and don't forget to subscribe for more straightforward, science-backed spine health advice.